We're happy to have Dr. Benjamin Humphreys with us now to talk about the session entitled Late-Breaking Clinical Trials. Always a popular session. Thank you for telling us a little bit about it today. Give us a little overview of what this session entails.
Well, this session is always the best attended scientific session of all of Kidney Week. And there is an element of excitement among the audience in attendance because there are 8 oral presentations of what have been deemed to be high impact clinical trials, as well as a poster session of another 20 or 23 posters of high impact clinical trials. And I think the reason this session resonates with so many attendees of Kidney Week is that the theme is on improving care for our patients across the spectrum of illnesses that they suffer from, whether it's chronic kidney disease or acute kidney injury or dialysis or cardiovascular morbidities. All of these trials are aimed at improving the care of our patients, and it's our first chance to find out how we might change our practice to improve care. And so I think that's why it is such a popular session.
Now, I know you don't want to go into details about these trials, but could you give us sort of a list of some of the topics that will be discussed?
Yes, I'd be happy to. And I'm also very pleased to say that this year we had more applications than we have had in prior years, which continues a trend of increasing numbers of clinical trials in nephrology, which in and of itself is an important and exciting development. Now, there are several themes represented on the trials that will be presented at the plenary session, and one of those themes is how to better manage diabetes in patients who have later stages of chronic kidney disease. And this is an area where there really are few or no drugs that are approved to lower glucose in patients with late stage chronic kidney disease. And there are 2 trials that will be presented that have examined glucose lowering therapies in those populations, and I think those potentially will change clinical practice for our patients. There is another study that has examined the impact of blood transfusions in the risk of acute kidney injury when patients undergo cardiac surgery, and whether we can reduce that risk by lowering goals for transfusion. Another trial will examine potential interventions to treat depression amongst our patients who have kidney failure and are on dialysis, and this is unfortunately an important clinical problem with few well-examined interventions, and so I think this is potentially impactful as well. And finally, one other trial to mention, although not covering all of the studies that will be presented, a Canadian trial has examined whether they can attempt to delay onset of dialysis for patients until they have a lower degree of kidney function, because we know that starting early doesn't help. And so it will be interesting to see on a sort of very population basis whether they are able to achieve success.
Possibly some breakthrough information coming out of that
session. It will be very exciting.
And I would imagine that you hope that the impact of all of this, or the effect of all of this, will, like you said, really be a great impact on the way you treat your patients.
That's right, and that's why I think it resonates so much, is because we all want to do the best for our patients, and this is how new knowledge is generated in the clinical realm, is by doing large randomized trials. That's how we take steps forward and give hope to our patients that better treatments and better outcomes are in the offing.
That session, Late-Breaking Clinical Trials, a popular one. Better get there early
to get
a spot for sure. Dr. Benjamin Humphreys, thank you so much for giving us this information. ASNTV has all the coverage you want from this year's conference. Be sure to check out all of the content, which is updated every day here on YouTube during Kidney Week 2018.